you made me do. Look what I made for you. Knew if I paid my dues, how will they pay you? When you first come in the game, they try to play you. Then you drop a couple of hits, look how they wave to you. From Marcy to Madison Square, to the only thing that matters is just a matter of years. As fate will have it, J status appears to be at an all-time high. Perfect time to say goodbye. When I come back like Joy, we're in the 4-5. It ain't to play games with you, it's to aim at you. Probably blame you. If I owe you, I'm blowing you to smithereens. Cocksucker, take one for your team. And I need you to remember one thing. I came, I saw, I conquered. Record sale, sold out concerts.
All right, it's Jay-Z. Jay-Z's in the lyrics. And then what's going on in the background, Diane Swan?
So what he's done, he's taken tracks, I believe it's Savoy Truffle and Glass Onion. Glass Onion, yeah, and he's taken little snips, looped them, mashed them up, put them underneath Jay-Z's vocal to form the music bed. So that's the Beatles with Jay-Z.
Yeah.
And it's just got amazing energy, hasn't it?
It has. It would have put Danger Mouse completely on the map, taking such iconic albums and creating something new.
Yeah, he didn't. He thinks he did. He says that he didn't know it was going to go so crazy. EMI tried to stop him at every turn.
Are they Jay-Z's people?
Beatles,
Yeah.
even though Paul McCartney and Ringo both loved it. Yeah, they just said that it was, it was innovative. It was great to be involved in something like that, and how they felt so removed from the hip hop scene that it helped them feel like that was kind of relevant.
Yeah.
Yet the record company absolutely tried to stop everything, which is kind of interesting because that album brought him to the attention of Damon Albarn from Blur, and he had released one album with Gorillaz, which had done okay, but he actually thought, I want to work with this guy, Danger Mouse, which, catapulted him into this amazing arena from kind of being nowhere to being asked to produce the Gorillaz, which are, quite a massive thing.
And Damon Albarn is sort of famously an assembler of great talent, right?
Yes, absolutely. It's one of his strong points, I think. And he could just see that this place that Danger Mouse was going was somewhere that would work really well with Gorillaz. So, ironically, Gorillaz were signed to EMI. So when Damon Albarn said, I want to work with Danger Mouse, that kind of... They just had to leave him alone, and basically the results were incredible. I think.
So can you hear Danger Mouse's impact on, say, this track that we're going to play? It's kind of a famous Gorillaz track, but can you compare this to, say, Clint Eastwood or one of the tracks from the first Gorillaz album and say that was his influence?
Well, I wish I was that well listened.
Same.
Yeah, I wish I had more time in my life. I intended, but when I wanted to do this feature, I intended listening to absolutely everything 100 times. But look, I can actually hear the difference. It's just his sensibility with the amazing grooves, the sound that he gets on the drums, and also he introduces these kind of vintagey sounds and play. It's kind of like the playful nature, I think, works really well, and it works so well with Damon Albarn's vocal.
Songwriting,
Yeah, so I thought if we wanted to listen to Feel Good Inc., which also features De La Soul, that's a really, really great track from that album.
Is it just a De La Soul sample, or are they actually involved?
I don't know.
Yeah. Let's find out.
Need to do my research.
Here it comes.
Well, kia ora koutou katoa. Welcome again to the media stand-up here at the Ministry of Health, and thank you for including our sign language interpreter in your picture. I have with me today the Clinical Leader for Infection Services at Capital and Coast District Health Board, Dr. Michelle Baum. She's going to talk shortly about what's happening within hospitals in terms of preparation for COVID-19 and the support that the clinical staff are getting, but also talk a little bit about the testing. I know there's quite a lot of interest in that testing process and about who gets tested and why, and she'll talk to that. But just a few opening comments from me. New Zealand still has just the one confirmed case of COVID-19. That person is stable in Auckland City Hospital and continues to improve, which is pleasing. We still have the 6 people in quarantine at Whangaparaoa. Those are the folk who came off the Diamond Princess, and they will have completed their 14 days in isolation later this week and will be released from that quarantine back to their homes following final checks. They also remain well. The cruise ship that docked at Tauranga yesterday, the Voyager of the Seas, has been assessed when it arrived by the local medical officer of health, and as we anticipated from our assessment before it docked, there were no COVID-19 cases on board and no risk that there was in the first place. There are a handful of cases of influenza and gastroenteritis. However, this is not at all uncommon on cruise ships, and that's why they have very good systems in place to detect and isolate people who get unwell with these conditions, and they have ship's doctors on board. So I'd like now just to hand over to Dr. Baum, and she can talk you through some interesting clinical aspects of the COVID-19 response.
Thank you very much. So I wanted to just talk about the COVID-19 response at a DHB level, with my DHB as an example, although we have not yet had a case in the Wellington region. But all DHBs have been preparing for the last several weeks. Ours has been meeting, have had a watch group that's been meeting a couple of times a week already, and in close communication with DHBs within our region, and trying to formulate a coordinated response. At this stage, because there haven't been cases in our region, we've been focusing on early identification of any potential cases and being able to get messages to those people who are on the front line and support them. At this stage, if you were to be concerned about having coronavirus infection, and if a person were coming in that may meet the case definition, they would be seen by either a primary care physician or an emergency department physician through the health services. They would have a risk assessment done based on their own symptoms, so an individualised risk assessment, and based on where they'd been travelling. Every case at the moment is still discussed with the medical officer of health on call at Regional Public Health or with the clinical microbiologist, and all tests are discussed with the clinical microbiologist so that we're making sure that we're testing the right people, but also testing anyone who has a high degree of suspicion, who we have a high clinical suspicion as well. So we are following the case definition as per the Ministry of Health, but that needs to be adaptive according to the information that's coming in from around the country and from overseas. There has been some concerns that there's rationing of tests across the country. This isn't true. There is capacity in the within the country to test hundreds of patients a day at the moment. This can be done either through ESR or through several large laboratories, and at the moment my understanding is capacity is somewhere between 500 and 1,000 tests a day. So there is certainly the capacity for testing, and this can easily be ramped up over the next few weeks as well. The key point is, I think, that nobody wants to miss the first COVID-19 case within the region, so we are proactively managing as required. One thing to state, I think, that's really important is if you are worried that you have COVID-19, it's a good idea not to front up without prior arrangement at an emergency department or at your primary care provider. This will overwhelm our frontline services very fast. The best thing you can do is to follow Ministry of Health advice on their webpage or to go through the Healthline. There's a dedicated COVID-19 Healthline, and I'd encourage people to call there first to get advice. They will be able to tell you and direct you where to go after that, and to make sure that people are ready and waiting so that you can receive the care that you need. I've also been facing some questions about when is the right time to test, and we know that it's not a good idea to test asymptomatic people at the moment on the current evidence available. It is likely to give a false sense of security. We would like to preserve to use the testing wisely in people who are most likely to give a correct result. We know that the test reliably performs in people who have symptoms, and we want to really use it on those that are meeting the case definition. So it's not that the test is being rationed, it's just that we want to use it in the appropriate circumstances to be able to make a clinical decision based on that result. Probably all I have to say. Thank you.
Thanks, Michelle, and both Michelle and I will be here, obviously, to answer questions at the end of my further comments. So, as you know, we've had our one positive test. However, we still assess our likelihood of a widespread community outbreak as low. We're continuing, though, to expect sporadic cases. But we have public health measures and border measures in place that will improve our chances, not just of preventing cases coming in, but of identifying cases early, as Michelle spoke to, and putting in appropriate measures to contain and prevent further spread. Just on the tests, and a further comment here, we've now completed 155 tests. As you know, only one of those has been positive. There are 31 tests underway at the moment, so at any point in time there is a number of tests in place. I mentioned 2 yesterday. I can confirm that one of those has come back negative. There is a lot of interest, and we are expecting the other one later today, and we'll give an update on the outcome of that test either way. But it's important to emphasise again that there is constantly a number of tests underway, and we would only add additional detail if a case proved to have a positive result. Internationally, I've talked about the regular communication we are having with our Australian counterparts, including the Prime Minister, the Minister of Health, who has spoken this morning with Greg Hunt, the Minister of Health in Australia, and also at an officials level. And we also have our Prime Minister's Chief Science Advisor, Professor Juliet Gerard, linking with her counterparts around the world. And this morning she was involved in a teleconference with her counterparts, which was convened by the Director of the White House Office of Science and Technology, Dr. Kelvin Drogemeyer. Now, that included Chief Science Advisors from Japan and Italy, so very helpful. It's just one of the ways that we are able to link with other countries and make sure we've got the latest and most up-to-date science, and also the measures that other countries are implementing and learning from them. Now, there is apparently going to be a public statement that will be put out by the White House Chief Science Advisor or the Director of the White House Office of Science and Technology, so keep an eye out for that. We also continue to get advice from our technical advisory group that was set up specifically to advise on COVID-19. It includes infection control experts, public health experts and clinicians, both hospital and primary care clinicians. It's now established a number of subgroups around primary care, around infection prevention and control, and so we have really good scientific evidence to constantly inform our response. Just on our public awareness campaign and playing our part, I do like to include quotes from the Director General of the World Health Organization, Dr. Tedros, and one I do like he's just said, which is, there are things that every country can do and things that every person can do. And our current public awareness campaign is targeted at those things that individuals and families can do to protect themselves and others. You'll be aware that at the border we are collecting information about people coming back from those places of concern, and that yesterday the Prime Minister announced that we are also now expecting people coming in from South Korea and from northern Italy, the 3 provinces in the north of Italy, to self-isolate for 14 days to help reduce the risk that anyone who might be infected but asymptomatic from those regions coming into New Zealand could spread it. And those are the two regions where, at the moment, in particular, two provinces in South Korea, or the Republic of Korea, and Northern Italy, that's where, in addition to Iran, there is the highest level of ongoing community transmission. So that's why we have chosen those areas. We're particularly concerned about Iran, and you know that that has been added to the small list that included China only previously, where we are not allowing people to come into New Zealand unless they are Kiwis. And anyone who came in from Iran in the last 14 days, we are requesting and strongly recommending they go into self-isolation. Let me just, just one other thing at the border. We're just strengthening our approach at the border, our presence at the border. I did mention yesterday that we are now moving to a universal approach to ensuring everyone coming into the country receives information while in flight, both through announcements and a card they will receive with their arrival card about what to do if they are symptomatic, about the countries that we are, if they are travelling from those countries or places that we are requiring them to go into self-isolation. So we will also be just upping the presence of our health staff at the border, not to do screening. And again, if you look at the latest WHO advice about screening at the border, particularly temperature screening, it has very little role to play. The key thing is ensuring that everybody has information about what the symptoms are and what to do if they are symptomatic. And just to finish and reiterate the point Michelle made earlier on, if you are symptomatic and you are concerned it's coronavirus because you have been in a place where the COVID-19 virus is, then call Healthline or if you're going to see your GP, call ahead. And finally, just on Healthline, yesterday was the biggest day they had ever had, over 1,600 calls to Healthline, more than 80% growth on the same day last year. Some people, there are some quite long waits on Healthline, and I want to just make a plea. Healthline is not there to provide travel advice about whether people should undertake their international travel. The best place for information on that is the Ministry of Foreign Affairs and Trade's Safe Travel website or our own website. Remember that many of the people ringing Healthline are not ringing about COVID-19 but about other health issues, and they need to speak to someone. So please, can I just ask people to be judicious in their calling of Healthline to make sure that staff are able to speak to the people who are most in need of health advice, either about COVID-19 or about other health issues. Again, if it's about your own travel plans, please use the Safe Travel website. It is excellent, and or get advice from your own GP or travel agent. So we'll finish there and open for questions.
Those tests, 155, have they all been sent to Melbourne or are they being tested here in New Zealand?
We've been doing all the testing in New Zealand for some weeks now. It was only in the first week or week and a half that tests were going to Melbourne. Then we stood up the ESR laboratory here in Wellington, and subsequently the laboratory in Canterbury and in Auckland have been able to test as well. So all the testing's been done in New Zealand now.
Can you talk us through the process for what happens for people who are arriving from Northern Italy and South Korea?
Yes, so those people will receive information at the airport. They will be asked if they've been in those areas. They will receive information, and a health person at the airport will talk to them about their understanding of the expectations. They will be required to register with Healthline, and they will be given the information about how to self-isolate. And as I've mentioned previously, we've seen thousands of Kiwis coming back from China who have done that successfully and contributed to our overall public health effort.
But if they're not wanting to self-isolate for whatever reason, what happens then?
So I've talked to previously, this is a high trust arrangement. There's no enforcement of that, but I think everybody here is very clear that self-isolation is an expectation, and also that it can be successfully done, and there's work with employers and others to make sure that people are supported to be able to self-isolate.
Going back to that testing, those tests that were sent to Melbourne, were those results different from what you possibly got in New Zealand? Now, we're asking this because it appears that the person who did contract the virus was twice tested here, and came out negative, and then got a positive result in Melbourne. Can you explain that?
So just to correct there, the third test was actually done here in New Zealand. So all our testing has been done in New Zealand. And again, and I've explained this over the last few days, so that the third sample that was tested was a sputum sample. It was different from the throat swabs, and it was because of the high level of suspicion of the clinicians, the nature of the infection, that they wanted that sample, and they waited until they had that sample. It was tested here, actually in the Auckland laboratory, and proved positive.
Dr. Bloomfield, just to clarify, so there have been no new suspected cases over the last 24 hours?
No, that's correct. And at the moment, we've got over 30 tests being done. So I think this is good. We are testing people. As Michelle says, no one wants to miss a case. There is a high level of awareness, and whilst we are making sure we are testing to ensure we get the cases and we are testing the right people, there's certainly not any problem with laboratory capacity. So we're testing everybody who we think needs to be tested.
Just on the test that we're waiting for, is there any relation to the test that came back negative as well, out of those two that have been tested?
No.
The current confirmed case, is that patient well enough to be discharged and isolated at home?
They're still improving, and the decision about discharge will be with the clinicians who are caring for the person.
So no indication when that might happen?
No, not at this stage.
If we talk about a worst case scenario, a community outbreak, can you just talk us through who would be most at risk if that was to occur?
Yes, sure. Well, what we've seen from the evidence from outbreaks overseas, and even the early evidence from China, is the people who are at most risk of severe complications or of dying, those are older people, so we generally say over 65, and people with pre-existing conditions. That seems to be very clear. They're at the highest risk of severe illness. So we'll be wanting to make sure we are protecting those people as much as we can. And one of the things I've talked about is ensuring that those people over 65 and people with pre-existing medical conditions are eligible for a free influenza vaccination. Now, the influenza vaccination does not provide any protection against COVID-19. However, those are the people, if they do get flu, who are more likely to end up in hospital, and we want them to avoid going to hospital for the flu, because that ensures there's capacity in our hospitals if we have a COVID-19 outbreak, and of course it keeps them well over winter. This morning I convened a teleconference with all the District Health Board chief executives and asked them to ensure that they were working with their aged residential care providers in their area and including them in their planning for any further responses to COVID-19, so they are also part of the planning.
What is that planning what are the plans if something happens like that? What are the plans for those elderly population?
Well, the people in aged residential care settings, like other institutional settings, for example, university halls of residence, medical barracks, military barracks, and even hospitals, you could argue, where you've got a lot of people close together, are ones where we're especially thoughtful about making sure you don't get infection there in the first place, and then putting in place measures if you do. I wonder, Michelle, if you wanted to comment at all on the sorts of things you might do, because we already get norovirus outbreaks, which is a gastrointestinal illness, sometimes in aged residential care settings. So have you got some comments to make about what we might do there?
I think there's a range of things that can be done. These follow along the lines of plans that are enacted every year for managing influenza. And most of the measures that are used to manage influenza in aged and residential care facilities will be helpful to manage COVID-19. Those involve early recognition of any person who might be affected by COVID-19, making sure that there's not transmission to other residents, and to make sure that staff know what to do in order to protect themselves and other residents. So they would be the starting point, and the first thing we have to do is have regional discussions with our aged and residential care facilities to go over the plans that they have in place already and adapt these for COVID-19.
The World Health Organisation is advising over 60s to avoid crowded areas. Does the Ministry of Health support that? It seems to me it'd be rather difficult.
I think one thing that the interventions overseas have shown, and I think Singapore is actually a really good example of this, is that you can contain an outbreak in its early stages, or at least you can minimise the impact on the community and on healthcare services by putting in a response. It's very difficult to say things like, don't go into a crowded space, because what's the definition of that? I think what's going to be really, really important is having sensible messaging and things that people can do to protect themselves. There are countries overseas that are limiting large gatherings, and that's because there is community transmission there. This is not the stage we're at the moment.
So there's no government preventative measures to keep elderly people safe? I suppose that's the next question at this stage.
Well, actually, the measures we've got in place at the moment to keep it out are keeping not just elderly people safe, but all New Zealanders safe. So at the moment, that's the phase we're in, and that's working well. And of course, especially because we know older people and people with pre-existing conditions are the most susceptible to complications. As we move into the next phases, they're a real focus for planning, as are other vulnerable communities, for example, people who are in disabled residential care as well.
Aged care representatives have been critical,
Yes.
though, of the response and saying that there hasn't been a nationally coordinated response with them in mind. Do you think
Yeah.
that criticism is warranted?
Look, I discussed this morning with Minister Salesa because the aged residential care sector had reached out to her. Actually, I know that many DHBs, and they had acknowledged this, the aged residential care reps, many DHBs have already reached out and are involving aged residential care providers in their areas. We're in establishing the next phase of our planning in the National Health Coordination Centre. We've got one of our aged residential care team members here as part of that planning, and we're talking with them directly at a national level, as well as the district health boards locally, which is, of course, making sure they're part of the local planning.
Given the rise of silent transmission overseas, should you be testing more widely because not everyone has to travel in order to be infected?
So I think just on the silent transmission, and Michelle may want to comment as well, there's still the evidence around whether people are infectious and transmitting when they don't have any symptoms is, I think, still equivocal. The main way this virus is transmitted is when people are symptomatic, through coughing and sneezing, droplet spread, or through infected surfaces and people having poor hygiene. And so those are the things we know about. Michelle, did you want to comment on that?
I think just briefly to say that a flexible response is going to be what's required. We're going to have to adapt the testing as per the case definition, and we're going to have to adapt the case definition as to what's going on here and overseas.
Do you know how the criteria for testing will change?
That's based on advice from the Ministry of Health, and that advice is contributed to by a range of infection experts from around the country. So I think this is something they're definitely looking at and assessing frequently.
And
Sorry.
And just on that, again, this is one of the real advantages we have in having been able to stay in this keep it out phase for so long, is we've been able to watch the development of the way the virus behaves and the epidemiology overseas, as well as the impact of control measures. And so we will continue to adapt the case definition to look at and include new areas of concern around the epidemiology and the growing knowledge about how the virus transmits and the growing knowledge about what the symptoms are, so how people will be presenting. Perhaps one more question, if there's anything.
Dr. Bloomfield, just another one. How many people are DHBs or the ministry helping to find places to stay if they can't find somewhere when they need to self-isolate?
Look, I don't have the answer to that. We're not helping anyone directly, and most people are able to find somewhere. In fact, Healthline has been, even since we brought in the measures for people coming back from China on the 3rd of February, Healthline has had people who have had challenges with that, and other government agencies have assisted in that case, so we've been able to find everyone accommodation. I think one of the specific issues you might be talking about too is people who may be close contacts, for example, from the case on the Emirates flight. The DHBs have helped with finding people places to stay who are under supervised close observation during that 14-day period, so where they need to, they will help there. Let's just leave it there. Thanks very much. Appreciate you coming and look forward to seeing you again.